I'm Amanda, I'm a certified sex therapist, and today I'm answering the question of what to expect in sex therapy for couples. Hit subscribe and like to get notified of our videos that come out Wednesdays at 9 a.m. Eastern Standard Time, and if you stay until the end, you can get the link for How to Seduce Your Spouse, which is a free webinar. It took me 200 hours to make. It's a 45-minute video with different strategies to use when you're in a partnership that's been at least around 3 years and you're feeling stuck or blocked when it comes to the spark. So if you stay until the end, you can get that description. Let's jump into answering what to expect in sex therapy for couples. So the first thing that you do when you go into sex therapy is you fill out an intake. If it's for couples, you both fill out an intake. Often, the clinician will ask for both of you to come in. Also, if you're a moresome in an open relationship, sometimes the whole polycule might come in, etc. However, it could be broken up into couples or dyads. So for couples therapy, you'll each fill out intake paperwork, and the intake will take 1 to 2 sessions of gathering information and having the therapist attune with you and try to understand what you're trying to achieve. What are your goals and outcomes so that the therapist can help create strategies that will get you to those outcomes. We need your willingness, of course, as a sex therapist, because without that, there's not really any way we can help you. Once we have the intake sessions and your willingness, we write down your goals, the therapy process can begin. Yes, all of that is part of the therapy process, and it sets the foundation for the work that will have to come. We can't just think about sex and have it change. Yes, the brain is the most important part of the body when it comes to sexual satisfaction. However, what is equally as important is making sure that you are willing to do new strategies and new things so that you get new results. If you just sit back and wait for things to happen, you'll probably get the same results that you've always gotten. Curious for those watching, have you gone to couples therapy before? Many times, by the time a client gets to me, I might be the 5th therapist on the case already. So, if you're a couple watching, I'd love to know your experience in couples therapy. You can comment below. For a sex therapist who's working with a couple, be mindful that the therapist has to balance each of your emotions, thoughts, and strategies to get your needs met while you're both in the room. Often when you're an individual within a couple, you don't realize this, but subconsciously, you might really want the therapist to be aligning with you so that your partner can see that your strategy makes sense and you might be right. The goal, though, of couples therapy and sex therapy for me is not for each of you to be right, but to collaborate in a way where you both get your needs met instead of either or. So instead of arguing over who's right, it's about creating a path where you're a team together and then your needs get met because each of you trusts the other to caretake yourself, caretake the other, caretake yourself, caretake the other. A sex therapist will give you plenty of permission, active listening, attunement, and reflective engagement as you speak with them. Sometimes you'll wonder why your partner doesn't do the same type of listening. If you think about it though, therapists, especially sex therapists, are trained and they have a ton of experience in that type of listening. And we are able to do it so well because we are with clients for a certain amount of time a week. Imagine though, when you're with a partner, you guys are together multiple hours a week, and it's much harder to continue to attune to a partner. The Gottmans, who are big researchers when it comes to couples counseling, say that we really only spend 9% of our time with our partner engaged with them. So I think that's important to note, that you cannot expect that someone else will be attuned and reflecting, listening back to you in the way that a sex therapist can within the moments that you're with them. When we get to the limited information stage of therapy, often clients might have questions. They think, where did the spark go? It's not like my past relationship. Well, a lot of different things are happening, and the neurobiology of love and lust and attachment is often at play. If you know Helen Fisher's work, you will know more about the brain systems and the different neurobiology that's happening in the body while you're falling in love. I did a whole video on the stages of how long does it take to fall in love, so you can get all that information there. In the description below, we'll drop a link. With that being said, this is something a sex therapist will do to help you understand that what you're seeing in the media, what you might remember of your past relationship, or what you might recall and wish is your relationship, might be possible, yet it might be a fantasy that actually can't become a reality when you're sharing so many different roles with your partner. Therefore, a sex therapist will help you create a win that feels really good for you, really good for them, and is grounded in actual neurobiology and evidence-based practices for long-term couples to get relationship and sexual satisfaction. Another thing that a couples therapist would do is use specific suggestions such as peer-reviewed articles or giving evidence-based videos to show couples things like sensate focus or somatic practices, tantric breath work, and other things such as creating a BDSM scene and consent, so that couples begin to learn new strategies to communicate with one another and meet their needs. The sex therapist isn't attached to what the strategy is. They're attached to helping you get your goals accomplished. A sex therapist might also give you homework to do, and that is something that might be different than when you're in individual therapy doing more processing sessions than trying to get to a certain outcome like you would in sex therapy. For those of you who get to the last stage of sex therapy where it's more intensive model, you might learn skills like DBT, TFCBT, EMDR, or even things like internal family systems, Francesca Gentili's inner aspect model. All of these different types of ways of looking at the current situation help people who are stuck within their coupledom get to where they want to be. So, thank you for staying till the end. If you want, you can get the How to Seduce Your Spouse webinar free. Scroll down, you can see the link there, click on it, fill in your information, and you will get an email with the link to the landing page. If you like this video, hit like, subscribe, and the bell. I release new videos Wednesdays, 9 a.m. Eastern Standard Time. You can follow me on Facebook, Instagram, Twitter, and YouTube at The Sex Healer or at Amanda Pasciucco. See you next week, and thanks for watching.